In case it got lost in the shuffle with a lot of words, the fact is that this is one of the rare examples where a company did the basic science. They found this whole pathway in their own laboratories through basic discovery and then proceeded to make a medicine that will alleviate huge amounts of human suffering. It's a lesson, it's an inspiration for all of us who work in the industry. This is our dream, to start with the basic. We make the basic science. We don't get it from some Harvard academics. We make the basic science discoveries and then convert them into meaningful medicines. I salute the scientists and the leaders at Amgen. Now, finally, the award for the best pharmaceutical product, and that award will be presented by Professor Bengt Samuelsson of the Karolinska Institutet in Stockholm, Sweden. Professor Samuelsson was the former rector of that institute and also a Nobel Prize winner and head of the Nobel Committee, and what else can I say?
Thank you, Mark. You got it almost right. So the award for the best pharmaceutical agent is given to Prevnar13. So, ladies and gentlemen, the third prize for drug development this year is for the best pharmaceutical product. The prize to Pfizer's Prevnar13 is for the development of a synthetic pneumococcal vaccine for children. Prevnar13 is indicated for an active immunization of children from 6 weeks through 5 years of age against invasive disease caused by Streptococcus pneumonia. The illnesses caused by Streptococcus pneumonia include meningitis, sepsis, pneumonia, and ear infections. The new Prevnar vaccine, Prevnar13, protects against a virulent subtype of Streptococcus pneumonia called strain 19A, a growing threat to health that accounts for about 10% of the bacterial diseases. It became resistant to antibiotics about 6 years ago. When we discuss vaccination, our thoughts often go to the English scientist Edward Jenner. Jenner is widely credited as a pioneer of smallpox vaccine. He trained under the surgeon John Hunter. According to William Osler, Hunter repeated William Harvey's advice, "Don't think, try." In 1796, Jenner tested the hypothesis that cowpox protected milkmaids from smallpox by inoculating James Phipps, the son of his gardener, with material from the cowpox blisters of the hand of Sarah Nelmes, a milkmaid who had caught cowpox from a cow called Blossom. He then injected the boy with varus material, and after noting that the boy did not develop smallpox, he continued the development. Contrary to William Harvey's advice, the scientists at Pfizer did a lot of thinking. When developing Prevnar13, they were forced to decide which serotypes to include in the synthetic vaccine. The original heptavalent pneumococcal vaccine, Prevnar, lacked coverage against several important serotypes. This was especially true for serotypes that predominate in the developing world, and particularly against the invasive serotype 19A, which acquired antibiotic resistance. The next challenge was to almost double the number of individual polysaccharide conjugates in the vaccine. Each new conjugate required the development of individualized conjugation chemistries. The expanded coverage of Prevnar13 was inferred by measuring relative antibody responses against the 6 new serotypes included in the expanded vaccine. Post-marketing surveillance has already confirmed the effectiveness of Prevnar13 against serotype 19A, given the relatively high incidence of disease caused by this type. Invasive pneumococcal disease is the most serious manifestation of the infection, with mortality and lifelong debilitation for many of the children who survive the infection. Globally, the WHO estimates that each year more than 1 million children less than 5 years of age die from pneumococcal disease, making it the #1 cause of vaccine-preventable deaths globally. The vaccine is now being used in over 60 countries and is currently being introduced in many developing world countries under the auspices of the Gavi Alliance and the WHO. The use of the vaccine is expected to save millions of children and dramatically reduce the economic burden of this disease. The excellence of the science and development demonstrated by the people at Pfizer make them superb recipients of the 2011 Prix Galien.
To accept the award for Pfizer, please welcome Dr. Emilio Emini, Chief Scientific Officer of Vaccine Research.
Thank you. Thank you very much, Professor Samuelson, Professor Brown, members of the committee, ladies and gentlemen, and colleagues. It is with considerable humility that I stand here today representing my Pfizer colleagues and all of the investigators who, over the years, have worked to make Prevnar13 a reality. You know, the pneumococcal organism was first recognized about 130 years ago, actually. And in the early parts of the 20th century, the pneumococcal organism, actually, as many of you know, played a significant role in the biomedical research of that era. But the pneumococcus is also a cause of very significant morbidity and mortality. Pneumococcal disease is today considered one of the most significant causes of childhood death around the world. And it is when the precursor to Prevnar13, the earlier vaccine known as Prevnar, was first introduced over a decade ago, it represented what at that time was an incredible technological advancement. The ability to render the polysaccharide capsule of the bacterial organism immunogenic so that it could in fact elicit an active and effective immune response in infants and in children. In those countries that introduced Prevnar back then, almost 12 years ago, in fact, those countries have experienced a almost amazing substantial decline in pneumococcal disease caused by the 7 serotypes that were in that vaccine. But as I mentioned a moment ago, in spite of that success, pneumococcal disease remains the largest cause of vaccine-preventable death in children worldwide. So it became quite evident some years ago that a second-generation vaccine was necessary. That became Prevnar13. It was important to add additional serotypes, not only to cover additional serotypes that were responsible for pneumococcal disease in developed countries, but particularly in developing countries as well. And as Professor Samuelson mentioned, it also became clear that given the importance of the disease and given the extraordinary efficacy of the vaccine, that it was necessary to develop new technological methods to assure the production of the tens of millions of doses, in fact, the hundreds of millions of doses that are required every year in order to make this vaccine available to the world's children. The development of this technology is actually all the more remarkable because, in fact, Prevnar13 is arguably one of the most complex, if not the most complex, biological product currently in production. And as all of my colleagues at Pfizer know, that the development of such a product, in fact, represents a considerable degree of organizational commitment and personal dedication. And my colleagues will forgive me for not putting a list of names up because literally this was the work that involved hundreds, in fact thousands of colleagues, and with such a long list I would inevitably forget someone and would have to explain to them tomorrow. So, but their personal dedication is well recognized, and again, it is with humility and gratitude that on their behalf I accept this award. Thank you.